breast cancer patients out there, radiation therapy is sometimes needed after surgery. So let's talk about how that affects the reconstruction, because there are some important things that you need to know. So first of all, the purpose of radiation therapy is to kill any little breast cells that are left behind, because even with the best mastectomy that's performed, there's still going to be some breast cells left behind. So the purpose of it is to reduce the risk of getting a recurrent breast cancer. And if a radiation oncologist recommends radiation, they're recommending it generally because the benefits outweigh the risks. There are some specific things you need to know and that I see in my practice as a plastic surgeon in terms of how the radiation can affect the reconstruction. Radiation in general tends to make tissues tight, feel firmer. So that's very relevant, especially in an implant reconstruction. So when you have an implant reconstruction, the body will respond to the implant by making a scar layer around it, which we call the implant capsule or the breast capsule. The risk of a capsular contracture, which means that scar layer becoming thick, is very high after radiation. So in the best of cases, we just accept that, if the patient has a capsular contracture after radiation, we just accept that the implant feels firmer. If the implant has a severe capsular contracture, that can change the way it looks. So the implant might sit higher on the chest wall, and that could create some asymmetry or differences in appearance between the breast that's been radiated and the one that's not radiated. If that difference is very big and the reconstruction doesn't look good, then you're going to need a revision procedure or potentially a reconstruction where you take the implant out and you replace it with your own tissue. So in general, when you radiate an implant, which you can do, and you can proceed with radiation therapy without it impacting the effectiveness of the radiation, but it can make the implant feel tighter, sit higher, look firmer, and create asymmetry. Oftentimes, and if the patient is a good candidate for it, depending on their body habitus and tissue that they have in other areas, one good way to combat some of the effects of radiation is to do a tissue-based reconstruction, which we call an autologous reconstruction. And the three most common places that will go on the body to recruit tissue, number one being the abdominal tissue, number two being the back tissue, which we call Latissimus dorsi flap, and the third is creating a breast from the inner thigh tissue. Having a flap reconstruction, which is the term that we use in reconstructive surgery to mean moving tissue from one area to another. The reason that flap reconstruction can reduce a lot of those problems that we see with radiation is because the simple fact you're moving unradiated tissue into the defect. So you have healthy tissue that's not been radiated, so we don't have the issues of the tight skin, the blood vessels, because the radiation is going to affect all of those tissue layers. So in general, if the reconstruction doesn't look good after radiation, you're going to start thinking about moving unradiated tissue into that defect to help create better shape and symmetry. So in summary, if you need radiation, if it's been recommended to you, please proceed with it, because the radiation oncologist feels that it reduces the risk of recurrence. Lean heavily on your plastic surgeon. Ask to discuss with them what could happen and what options do you have for me. If I end up needing radiation and it affects the aesthetics, there's often another plan that could be offered to help improve things.